We decided to focus on alcohol use because, quite frankly, there hasn't been any real innovation, any meaningful scaled innovation in the treatment of alcohol use yet. So we took a deep dive into the literature and we decided to build NorthStar, and we'll talk quite a bit more about what the program is all about.
Patients wait so long and things are just at rock bottom. They're losing their job, they're losing their spouse, they might be losing their kids before they get help, is because what's out there right now is just abstinence. It's abstinence-based programs where you have to go away, you have to leave your job, you have to really have a huge impact in your life.
The average success rate of AA is only 8%. The average success rate for detox is less than 10%. And the average success rate for rehab is actually 13%. My hope is to have NorthStar over time really create that same radical shift for patients who struggle with alcohol use disorder, and quite frankly, who struggle with any use disorder. The vast majority of this can and should, I believe, successfully be treated in the home. That's where patients' day-to-day lives are happening. So they're going to have better outcomes if we're there with them through their day-to-day over time. So as their stressors come up, we know how to help them cope with them. Medications, nutrients, remote monitoring, genetics, peer support, and navigation. Those are really the constructs upon which this company is based, which again mirrors what we do in chronic disease management. For peer support, we wanted to do something radically innovative. So we built a guiding council, 12 people, each of whom had lived experience themselves with substance use issues, to get their advice about how could we incorporate group work into NorthStar, but be doing it from home. So we decided to explore virtual reality. We thought VR would be a really innovative way to allow people to continue to be able to participate in group support, but now do it from the comfort of their home.
You also have this virtual reality aspect, which gives you another level of anonymity that for me was super helpful in just being able to be honest with other people.
Their ability to feel completely anonymous helps them to feel safe to say, I had a significant return to use last weekend, or ask a question that otherwise they'd be embarrassed to ask. The embarrassment goes away.
And you can really focus on you and what you're struggling with and be honest, and not have to worry at all about what somebody might be thinking or knowing about you.
My hope for NorthStar is that it is leading a monumental shift in how we approach all addictive disorder treatment. Opioid use disorder has led the way, but I think we need to do the same with all of the other use disorders and start moving this into the outpatient setting where longitudinal management has better outcomes for the very reason that it has better outcomes for other chronic medical disease.
Most patients say to us that by the second week, they're really starting to notice a difference in how their brain's working, their memory's coming back. We actually had this one young man say to us, I've read a book for the first time in years. I could pick it up, read it, and comprehend the paragraph that I just read for the first time in a long time.
The program offered both, a medical approach and with the, from the medications that helped, ease some of the anxiety associated with it. And then also all the vitamins and supplements really started to see an energy boost. The reduction was pretty quick. It came, significant reduction, and when I started getting 2-3 days of no drinking, I felt incredible.
The more people involved, engaged in supporting a patient's success, the better. If the patient has a therapist already, has a psychiatrist already, NorthStar simply becomes an addition to that team and collaborates with that team so that we together are surrounding the patient with all the varieties of different kinds of support they need to be successful. We have worked with detoxes, rehabs, psychiatrists, psychologists, licensed social workers, LMHCs. We work with the entire spectrum of providers.
Once they have made the decision that NorthStar is where they want to receive their care, we send them a kit, overnight it to their house in a box that is very discreet.
It contains the first 90 days of nutrients. We can adjust what nutrients we give each patient in terms of the dosing and how much once we get their laboratories back. There are 20 different key nutrients that we're replacing at NorthStar. that need to be replaced. So we send a standard set out to patients and then further adjust once we have labs.
And everything that they need in order to begin care is in that box. Their VR equipment is in that box. 3 months worth of nutrients, drug testing, a breathalyzer.
We also send a blood pressure and heart rate monitor because as we're helping people to taper off of alcohol at home successfully, when we're doing that process, we have to be able to monitor their heart rate and blood pressure carefully. And lastly, we send patients drink substitutes. We really believe that bringing the patients to the care is inefficient, and bringing the care to the patient is actually much more effective.
Our success rate is so high that oftentimes people look at us and say, there's no way that's your success rate, you're making it up. We are successful 85.7% of the time. Right now, our patients are meeting both their short-term and their long-term goals.
Because of NorthStar's consistency and the level of care and the fact that we have multiple levels of, like I said, peers, peer guides, nurses, doctors, it's able to kind of keep that engine going. So you may slow down a little bit if you have a bad day or a bad week or a return to use, but that engine never really stops. NorthStar kind of keeps it going for you. And so you're able to kind of continue.
For every single patient we help, we know that it's impacting 20 more people. So every single patient, it's their family, their extended family, their close friends, the people they work with. So many people are impacted when they get better. So it's really, truly a gift to get to do this work and be able to help people.